Hello everyone. I would like to mention about the Caesarean scar endometriosis. Normally the patients had a cesarean many years ago, and then we know that endometrial tissue, endometrium layers, some tissues is going and make invasions on the abdominal wall, and then they are getting bigger, they are getting higher, then they create some painful mass on the abdominal wall. So we know that conditions is Caesarean scar endometriosis. In that conditions, it takes too many years. We cannot say that when you had a cesarean, and we will see that the clinical conditions in some months or some weeks. But when the patient pays the 1 year, 2 years, or 5 years, or sometimes you can see that 10 years later, we can see that some painful mass on the abdominal wall. And that mass is very important feature is during the menstruations, you see that that ladies feel some painful mass on the Caesarean scar defect, and then you only touch that lesions. When you apply the ultrasound, there is an irregular mass on the abdominal wall. It can be make invasions on the muscle layer. Sometimes we see that invasions going below the fascia. Sometimes it can make invasions on the abdominal skin area, and because of that we will see that some blue or black colors change on the abdominal skin. So the typical treatment modality is surgical excisions with a clear margin. If we see clear margin on the lesions after the surgery, then we see that we solve that disease. So this kind of endometriosis is called Caesarean endometriosis or abdominal wall endometriosis. Both definition use that conditions. So the treatment is not so difficult. It is very easy. We know that clinical scenario takes too much time, but the solution takes sometimes 30 minutes, sometimes 1 hour, and then that pain is gone. That's the good point, and we know that the solution is not so difficult.